Thank you, everyone. You can be seated now. Good afternoon, ladies and gentlemen, distinguished deans, students, family and friends of students joining us here today, and family and friends of students joining us on live stream. A very warm welcome to the 2018 White Coat Ceremony at the Poznan University of Medical Sciences. Thank you. My name is Naila Hafid. I am a second-year student of the Advanced MD program, and this is my colleague, Jacqueline Jonik, a fifth-year student of the Doctor of Pharmacy program. Jacqueline and I are extremely honored to have been chosen as your Masters of Ceremony today. Before we start, we would like to greet our distinguished school authorities.
Please welcome Professor Grzegorz Oszkinis, Professor Katarzyna Ziemnicka, Professor Anna Jankowska, Professor Grzegorz Dworacki, Professor Franciszek Główka, Associate Professor Justyna Opydo-Szymaczek, and Associate Professor Jan Mazela.
This is it. You're here. You have completed first year. Now, as your upper years, we have some insider advice for you to succeed in second year. From this moment on, we suggest that you delete your Facebook, delete your Instagram, and delete your Snapchat. I am joking. I know I can see some concerns on some of your faces, though. We congratulate you on achieving this milestone. And above all, we want you to remember that if you have made it this far, you can definitely make it further. We believe that your journey doesn't start here. Your journey started when you first decided to become a medical professional. Now I know a lot of you are nervous, pondering about the journey ahead, whether it's going to be easier, harder. Let me tell you, as someone who has recently been in your shoes, there are going to be stressful days, tests, exams. You'll probably be chugging 10 cups of coffee a day, but believe in yourself. Never take sight off your goals. You have conquered first year. You can definitely conquer the rest. Becoming a doctor is a journey, not a destination. Your white coat today is not only a commitment symbol, but also your rite of passage into the culture of medical profession. As you don that white coat today and take the oath, you solemnly acknowledge to uphold with integrity the virtues of the medical profession, which are compassion, altruism, honor, and responsibility. When you wear that white coat, you can shed a tear or two. That's okay. I did that as the white coat draped my shoulders. It's very emotionally empowering. Appreciate its value. We would like to emphasize that you have chosen one of the most prestigious schools in all of Poland to fulfill your dreams. And we are grateful and proud of that. We have an excellent faculty, excellent professors. We're all working tirelessly to push you to your limits so you can persevere, excel, and surpass the goals and achievements that you have set for yourselves. They are here to pass down their wisdom, share their knowledge, and help you, shape you in the best version of a medical professional that we know you can and will become.
Dear students, you have chosen a field that intellectually challenges you every single day for the rest of your lives. I would like you to appreciate the beauty of medical sciences. It is going to bring out the best in you. Sure, it may not be noticeable in the beginning, but throughout the years, it will. It is going to enhance your emotional and critical thinking. It is going to solidify your strengths, build your character, and make you flourish into an individual with wisdom, compassion, and integrity. Please take a look to the person to your right, look to the person to your left, and in front of you. Yes, these were strangers 1 year ago, and then they became your friends. And now, they are your support system. Embrace them, cherish them. The journey is going to be way more fun with them. Live in the moment, but have your sight on the prize. Friends, when achieving your goals, if you want to go fast, go alone. But from my personal experience, if you want to go far, go together. Nyla, who is finishing up second year and getting ready to write her USMLE, and myself, who is finishing up my master thesis and entering my last year of studies, are living and breathing proof to tell you that you can do it, that no matter the obstacles, the hardships, it is possible. We understand that the expectations are enormous and come with great responsibility, but the professional satisfaction in the end is worth every single moment. As you continue on this journey, we wish you tremendous success, determination, and perseverance to become everything you are capable of being. Thank you very much. Now, we would like to welcome our first guest, who is a PUMS medicine graduate from the class of 2015. He is currently a second-year resident of the UK Foundation program at Oxford University Hospitals NHS Trust, is practicing plastic surgery at the John Radcliffe Hospital in Oxford, and will be starting his specialty training in internal medicine at Oxford in August. Please give a warm welcome to Dr. João Ramos Galante.
Thank you very much for the kind introduction. Good afternoon. Witam. Dear Professor Grzegorz Kinisz and all faculty, dear Mr. Grzegorz Hewusz and all members of the Dean's Office, Szanowni Państwo, dziękuję serdecznie za zaproszenie. Thank you very much for this invitation. It's an immense honor to be here today in this really important day to you. This means a lot to me too, so please forgive me if I start crying. So, dear future doctors of medicine and doctors of dental surgery, congratulations. This year is the beginning of a beautiful journey. Be proud of yourself. I'm proud of you. And life is never going to be the same. I will structure this talk by telling a few words about me, a few of the reasons why Poznan and this university are unique. And I will end with some tips that I wish I had when I was sitting there, and I believe can make the difference. So my name is João Gallant. I'm from Portugal. I did biomedical engineering in Portugal, and during my final year, I did Erasmus in Krakow. I created some links there that made me return, and I worked as an engineer in IT. I was about to start a PhD in stem cell and cancer research, but my passion for people and oncology brought me to medicine. So here is where I want to remind you that nothing is impossible. You can do anything. It's only impossible if you don't try. My life, for example, was full of impossibles. The first one was to be accepted here. I left the interview thinking, okay, that's it. I'm done. But then I made it. So since day one, I was so thankful and motivated that good results just came naturally. I was honored with university prizes every year. I'm very thankful for that. And then I had the opportunity to do electives at the University of Cambridge, King's College London, Johns Hopkins. I could never imagine this would be possible just 1 year before. Then I applied to the UK Foundation Program, which is a 2-year program for newly graduate. And that makes the transition between medical school and specialty training. There is a similar foundation program for dentistry, by the way. And actually, yesterday I was talking to one of my dear friends who graduated from here last year, and he was accepted there. And also accepted in a program in the US, a program in Taiwan, and among others. So the future looks bright to all of you here. For the medical foundation program in particular, you apply in October of your final year. I'm very happy to discuss the application and all the details. At any point, you can send me an email and everything else I'm talking about today. Don't hesitate to contact me. But in a nutshell, you have 50% of points which come from your educational and academic achievements, and 50% which is an exam. Then you just rank a unit of application. You rank 20 units of application, which are a group of hospitals, NHS Trust, and a foundation school, and they are linked to a university. Then you have, on the first year, 3 rotations of 4 months. And then on the second year, when you are full GMC registered, you have 3 more rotations. This is quite similar to the stage here in Poland and to what happens in Portugal and other countries, but quite different from the US, where you go straight to specialty. But in my opinion, it's definitely worth it and makes you a more complete doctor. It will allow for more effective communication, and you will understand what's going on in the other specialties. So I had the chance to start this program in Oxford. And I worked in psychiatry, emergency medicine, emergency surgery, gerontology, head and neck oncology, and now plastic surgery. By the way, now in plastic surgery at night, I cross-cover maxillofacial surgery, and all my senior colleagues are dentistry graduates. So to do MaxFax, you have to do both degrees, so this is a potential career outcome for all of us here. And I'm learning a lot from them. So when I got to Oxford, I was again very thankful, very, very motivated, and I decided I was going to make the best out of it. So I started to learn how to teach. I got involved in these courses they have, started to learn how to do research. Took some research courses, started to know more about quality improvement. And I joined the Oxford Foundation Trainees Group. This would all lead to incredible outcomes. A few months into my first rotation, I was teaching Oxford students. Oxford is ranked as the best medical university in the world. And recently I submitted my portfolio for formal teaching accreditation from the University of Oxford. I won a prize at the Oxford Research in Clinical Practice conference for the best quality improvement poster. And I will present in 2 weeks in an international conference. I could not possibly imagine any of this when I was just sitting there. But well, now I know it's possible. And you know too. Dream big. I was very dedicated to this trainees group in particular, where we bridge the gap between these training doctors and the senior leaders of the trust, of the university, of the hospitals. We are the voice of over 200 foundation doctors, and we make sure that their concerns, their suggestions are heard, and we make their training and their working lives better. In addition, we have a lot of projects like digital improvement, careers workshops, buddy scheme, just to maximize their experience and their future. My experience there was very positive. So I was invited this year for the director of from the Director of Medical Education to be the chair of this group. It's a wonderful opportunity, and I'm learning a lot about medical leadership. And multiple other doors opened again. I was subsequently voted and elected as the regional Oxford F2 representative by my colleagues and friends, and was invited to participate in the new Oxford Emerging Leaders program. And just before coming here, I was offered my specialty training post, and again, another impossible happened. I'll continue in Oxford. But all of these have never happened without the unconditional support of my family, friends, and beloved ones, and the Poznan University, including, for example, some faculty members like Dr. Kucharski, Professor Bromborowicz, who supported my application, and all of you. Thank you. So I'll never forget that it all started here. And I'll remind you some of the reasons why Poznan and the Poznan University of Medical Sciences are unique. You get the best of the American and the European teaching cultures. This is something you'll not find to this extent anywhere else. Departmental tests and exam together with the clinical teaching as we practice in Europe, and then BME examinations and courses that keep you on the same frequency and standards as the US students, and you can compare yourself to them and how you are performing. Never underestimate the importance of this. It will just add value and surely open you a lot of doors. You'll make friends from all over the world. I have friends in Poland, in the UK, US, Canada, Sudan, Sri Lanka, Lebanon, everywhere. I'm just mentioning a few. And you'll develop working relations and may even find love. You have state-of-the-art infrastructures here, and a fantastic simulation center and simulation training embedded in the curriculum. This is better than many top universities in the UK, where students sometimes don't have any simulation exposure whatsoever. And I always proudly talk about this when I have my simulation training as a doctor now. Please take advantage of that. It's a great learning experience. And this is also applicable to the dentistry program. All my colleagues say and tell me about the great hands-on experience they have. Please enjoy that. And you are in the center of Europe, literally. Take the time to explore, to travel, to find different tastes, different sounds, different cultures. I had such an amazing time traveling inside Poland and all over Europe. The world is so close. Just discover it. Well, so if you're still awake, I'll just leave some tips that I wish I had when I was sitting right there. First, study hard. There are no miracles. And no, oh, he did well or she did well because they are so smart. I'm sure you're all smart, or you wouldn't be here. I studied hard. That's not a shame. I loved it. I was getting better day by day, and step by step closer to my dream. It will be your dedication and your hard work that will make the difference. Being smart will not spontaneously know the reactions of the Krebs cycle or the intrinsic muscles of the hand. And by the way, I had questions on this recently on postgraduate exams. And there's not a single day in plastic surgery I don't have to do a hand examination. So please never underestimate the importance of what you're learning and of what your teachers here tell you you should know. It will pay off, believe me. Immerse yourself in this beautiful country. It's not just a passing place. You'll be living here for 4 to 6 years. and create some of the best memories of your life. Please make an effort to learn Polish. You don't want to be a tourist for all these years? Local people are always nice and welcoming anyway, but this will show additional commitment, dedication, respect. It changed my life and experience here, and it will definitely change yours. Polish friends and other important people I met here, in particular Magda and all the family Ruszkiewicz, were significant support throughout my path, and I'll never forget all they did for me. Be focused, but keep open-minded. You may have a target, you may have a goal, but keep the doors open to the opportunities that will appear. Life is wonderful and full of wonderful surprises. For example, when I did my elective in Cambridge, I spent one weekend in Oxford. I had already applied and got a job in London, but I just felt so happy, so inspired there, that I just said, this is where I have to be. So I took the risk, and I didn't accept my placement in London. I took 1 year off, applied again. That was not my initial plan at all. It just happened. I really felt that was the way forward, and I was right. It was the hardest, but best decision ever. Be curious. Don't limit yourself to the what, but ask why. Go one step further. Read medical journals like the New England Journal of Medicine. I first heard of this, by the way, here, by a dear professor of pathology, Professor Biczysko. I can't be more thankful to her for all the inspiration. It's vital to start learning from the beginning how to understand and critique medical research. The importance of being up to date. Up to date, by the way, is a very good online reference you can use for that. And of evidence-based medicine. And you can be involved in research from now. For instance, if you come across an unusual clinical presentation, talk to your supervisor. Do some literature search. It may be an opportunity to write up a case report or a case series. And it will not only let you share this knowledge with the medical community, but it will make you a much stronger applicant to the next steps. Work in partnership with the university. The Poznan University of Medical Sciences continues improving year after year, and is undoubtedly one of the best medical universities in Poland. And people I met abroad know this. But why not making it one of the best in Europe or in the world? And it is you that can make that happen. If there's something you feel that can be improved, just tell them. They want to hear from you. The hottest topic in Oxford, in Cambridge, and all these well-known places to learn the art of medicine is quality improvement. They're constantly sending out surveys, questionnaires, doing audits, quips, and encouraging medical students and junior doctors to be proactive, empowering them. They are the responsible for making those places the best, and you are too. There is always room for improvement. Think of solutions. I remember coming back from Cambridge all inspired, full of ideas, and I met with one of the doctors here who is responsible for medical education, and I just had some ideas of things that could potentially be done better, perhaps, and he not only listened to me, he made it happen. I see it happening now. So please do it. You look on the same direction. Work also together with your colleagues and stick together, be friends. In your medical career, you'll always work in teams. Doctors, nurses, dentist nurses, physiotherapists, radiographers, and many others will be part of your multidisciplinary team. Start developing that culture from day one, and your next steps will be much easier. Develop your empathy. You will study to get the knowledge and you'll get it. But medicine is much more than a list of diagnoses and treatments. Otherwise, it could be done by robots, right? If you ask a patient, what's the single most important thing for them in a clinical encounter, they will say is the way that the doctor interacts with them. So take the time to observe during your clinical years how your clinical tutors here interact with the patients. The eye contact, the body language, the tone of voice, everything matters. Learn from them. It will make you a better doctor. If you ask me among all wonderful things that happened to me, what's the one I'm the most proud of? I'll say it was this year being nominated for the Oxford Staff Recognition Awards for Excellence in Care. I was nominated by my colleagues, and they stressed the way I interact with the patients and with the team. Learn how to listen, how to negotiate, be respectful, be polite, and you'll be a much more complete doctor. I have also to remind you that there will be difficult times. I was there once too, and I remember looking at how much I had to know for some of the exams and think, no way. It may seem too much, too difficult, and even too overwhelming. But we have all done it, and you can do it. Always remember why you are here. This common dream that brought you here together today. Let this be the fuel that keeps you going. You'll become doctors of medicine and of dental surgery. And believe me, it's really worth it. I cannot imagine doing anything else. It's the most rewarding career. I really, really love it. And you will love it too. And remember, no one has the perfect record. They just have this perfect portion that they show you. There will be times you'll not succeed at first. You may hear some no's. You may fail some exams. I hope not. But if it happens, just don't give up. I didn't get into medicine the first time I tried. And what did I do? I just kept working. It just made me see how much it means to me. And that I should fight for it. Fight for your dream. It will come true. This also links to the importance of being passionate. When I was applying to my elective in the US, I sent multiple places emails, and I received multiple no's. But in the end, I got the place I really wanted, just the Johns Hopkins and that particular oncology program. And when I applied, I didn't talk about my grades or my grade average. That's definitely important for your future. But on this occasion, what made the difference was talking about me as a person, as an individual, as someone genuinely passionate about medicine and oncology, and who wants to learn from them. I had a reply on the same day. You all have something unique. You all have something you're passionate about, even if you didn't find it yet. Follow your passion. Fight for it. And in some years, I guarantee you, you'll have your own list of impossibles to share. But above all, remember that your career will be dedicated to others. This is the first year of the rest of your life. You will be doctors, doctors of medicine, doctors of dentistry. You'll have people's most valuable things in your hands, their health, their lives. They will trust you. They will need you. They should be your top priority. But also remember to take care of yourselves. Have hobbies, travel, have friends, spend time with your family and the other ones you love. Invest in yourself as a person, and you'll be healthier, happier. And your team and the patients will thank you for that. So to finalize, I would just like to thank the Poznan University of Medical Sciences for giving me the chance to be a student here and make my dream come true, and for helping making me who I am today. You will always be part of me. And to you, my dear colleagues, I just want to tell you that Poznan will always be my second home. Please let it be yours too. Thank you, and good luck.
Thank you, Dr. Ramos Galante, for that wonderful speech. We now would like to invite on stage a student who just graduated this morning from the PUMS 4-year MD program, class of 2018, to share a few words. Please welcome Dr. Julian Shanmughalingaraja.
Thank you, Jackie and Nyla. Oh, nice picture. Okay. So firstly, I'd like to thank you, deans and staff at the Dean's Office, for giving me the privilege to address you all on this memorable occasion. This year is indeed significant as the university marks 25 years since the introduction of its first English program. Firstly, I want to congratulate each of you on arriving at this milestone in your career. You have no doubt worked hard to achieve your goal of being accepted into medical school, and now you're on the verge of completing your first year as physicians in training. As each of you walk across this stage today to receive your white coat, your journey in clinical medicine will begin. As Nyla mentioned earlier, the white coat ceremony is a rite of passage, welcoming you as new students into the medical profession. Whether you are medical, dental, or pharmacy students, you are bound by the same professional commitments that bind all physicians. In the words of Sir William Osler, the practice of medicine is an art, not a trade, a calling, not a business. You have all answered that call. William Osler revolutionized how medicine is taught, and according to Osler, medicine is learned at the patient's bedside, and the medical curriculum has indeed changed from a time when medical students spent their first 2 years in lecture halls and labs to a time now when students are introduced to patient encounters and simulations earlier compared to before. I have graduated today, but I still remember the day 3 years ago when I was sat just like you in the audience, listening to a graduating student's speech, asking myself, is there still another 3 years to go till I'm done? Or will I even make it to graduation? Or will my selfie stick even work after ceremony so I can upload some pictures onto Facebook of us wearing our white coats? But anyway, the main point is that time flies by so fast, and I cannot emphasize enough the importance of seizing every opportunity you can get to better yourselves academically and socially. But before you begin helping patients, make sure you help each other out. Remember that you are on this journey together. You have all chosen this unique opportunity to study in a different country and embrace people from all walks of life. I advise you to get involved in research as early as you can using platforms like Journal Club. During my time here alone, I feel like the amount of student groups and events have increased drastically, and at least one of them are bound to cater to your specific needs or interest. Perhaps you can be a part of the change you want to see. I myself was involved with the Irish and British student group, serving as president last year and playing a key role in its transition from a fairly new to a more established student group. Me and my vice president were also able to use IBSG as a platform to co-found and organize the end-of-year ball, which I'm proud to say has now established itself as a regular part of the PUMS calendar. Being involved in different student societies allows you the opportunity to meet people, develop essential skills like being organized, working as part of or leading a team, as well as honing your communication skills. All these are very relevant to your future careers as physicians. Life in medical school is not easy, and during times of intense stress, like when faced with the horrors that are known as NBMEs, or studying for that next pathology block test, my parents, my partner, and my close friends are the ones who have always been there to instill belief in me and give me the confidence to carry on working hard towards that goal of becoming a doctor. So remember, your loved ones will always be there for you in times of need, and whenever you feel like giving up, always think about how hard you've worked to get here and exactly why you wanted to be here. And who knows, you may well meet your future life partner while you're at it. Finally, you need to remember you have embarked on a lifelong journey of learning, especially in a very dynamic field like medicine. So after 3 consecutive degrees, graduating today marks the end of 12 exhausting but unforgettable years of university life for me. But I am aware that as a doctor, I'll be nourishing my brain with new information for time to come. So my dear students, I would like to wish you all the very best of luck in your studies. And remember, if I've been able to do it, so can you. Perseverance, remember that. Thank you.
Thank you, Doctor. We wish you the best of luck in your future journey. Now we will begin the formal cloaking of students on stage by university authorities. And we would like to invite Andrei Chu from the second year of 6 MD program and Daniel Janusz from the second year of Advanced MD program to read the student names. We kindly remind you that only 7 students come on stage at a time with your coats unbuttoned and ready to be cloaked. Thank you.
Welcome, everyone. My name is Daniel, and today we're going to start with the Advanced MD program. So like Nyla mentioned, we're going to go 7 at a time. So we're going to start with Michael Adesina, Natasha Ahmed, Usman Ali, Belisa Asedu, Lavina Bangit, Joanna Grace Beltrano, and Jayant Bandari. Please hold your applause until the group of 7 is all the way up there. Marta Burak, Catherine Campbell, Tanchanok Chaprasit, Wei Yu Chang, Tang Yao Chang, Aneta Hojepa, Marcel Chouinard. Alicia Dragon, Edith Maria Garcia Edwin, Ali Eftekar, Rebecca Erickson, Walid Hujairi, Xiao Heng Su, and Yusuf Iqbal. Rohail Khalid, Mohammed Halil, Jahangir Khan, Yusuf Kozmi, Natapat Kitisaratama, Maria Koranteng Aisi, Yung Han Lai. Chao Hui Li, Melody Lin, Chris Yenchen Lo, Ashley Martin, Michael Mira, Connor Monteith, Leo Obamenti. Mateusz Ogledziński, Oladapo Joshua Olajamuko, Comfort Osinowo, Saidalawi Panagadan, Natalia Pop, Harisanjiv Rajendram, Parag Saha. Basem Salum, Kevin Sargun Garaja, Swati Singh, Yisu Seo, Asbjorn Skogen, Micah C., Walid Tahir. Hamza Tariq, Krija Turai Raja Singham, Malsha Walgamaj, Philin Walgamaj, Unam Watu, Kenny Wu, Wei Yi Jia. And a few more from Advanced MD. We have Cheng Ting Yu, Randy Yu, and Gintaras Petrosius.
And now for 6MD, Lydia Adiogon, Ewan Alexanderson, Catherine Banik, Olana Bero Bedada, Mieszko Brikis, Tung Chang, Po Chang Chen. Yu Chen Chen, Charlin Chang, Pingy Chang, Lian Chow, Edvard Dombrovsky, Edvard Doyle, Ashkan Ibrahimi. Susan Eichland, Nura Gare, Sunda Gausta, Trina Jarostveit, Ingrid Henriksen, Daniel She, Chuelin Xu, Isabel Huang. Andy Huang, Yuqing Huang, Andrea Wittsten, Andre Kafel, Sachin Kalra, Mariam Kazmi, Minxuan Ko. Philip Kocher, Paula Kompf, Catherine Kowalski, Tsuchi Kuo, Jacqueline Lesinski, Chunhao Liu, Håkon Löve. Rita Malouf, Teresa Martinson, Ileana Maciero, Philip Morgan, Alexandra Morani, Christina Nudga, Tanapat Panapongvasin. Buran Patel, Natnicha Pokai, Marta Polista, Teja Rumsta, Yuli Riebe, Arun Sam, Eyol Schwartzman. Lorna Smith, Christian Stoltenberg, Ellie Stout, Danielle Stratton, Milad Sulaiman, Supitsara Tavurongjit, Jermaine Chizo. Almost done. Vitsarut Tongboribun, Voripob Tongboribun, Ida von Ehrenheim, Ili Wang, Zenith Watana Gunvivut, Sin Watana Varigun, Jacqueline Wisnik. Chen Cheng Wu, Ponchanan Utiyahom. And now DDS, Mariam Ali, Gina Bakan, Spiridon Bakratsits, Yuli Buchnerberg, Mengja Chang, Mingting Chang, Wei Ting Chang. Wan Xuan Qi, Yuwei Chen, Shengqi Qi, Yuying Chang, Qingshuan Cho, Oz Demerguts, Jixin Fang.
Hitesh Garg, Julia Guzak, Abdullah Ahmed Hashim, Tung Ling Xie, Yu Wei Huang, Jie En Huang, Jennifer Indome. I know, right? The colors didn't help. Monpichaya Jamkrajay, Nikhil Kapoor, Mai Lin Kam, Yu Ting Leng, Yuche Liao, Simone Lisa Longwei, Robert Lubeshka. Iman Mazarmonga, Tarsika Mulataran, John Ferdia O'Brien, Cheng Min Oh, Basim Perzada, Noor Imad Sahone, Nisha Singh. David Solomonson. David Solomonson, Gurkarang Singh Tour, Gursmiran Tour, Fai Xiang Wang, Maken Wang, Chen Wei Wu, Li Yen Wu. Sylvia Visga, Jessica Yuna, Evan Handke, Azad Mohammed, Baizit Chakov, Tajinder Basi, Atiya Jakfar. Gia Khalid and Paul Zavatsky. Congratulations to all those receiving their white coats.
Now, we would like to welcome Associate Professor Justina Opeda-Szymaszek, Vice Dean of the Medical Faculty II for English Programs, to read the Hippocratic Oath.
Accepting with respect and gratitude the conferred title of physician, and being fully aware of the responsibilities involved with it, I do solemnly swear to fulfill my duties conscientiously, to protect human life and health, to prevent suffering and disease to the best of my knowledge, and to help bring relief to the sick, irrespective of any differences as to their race, religion, nationality, political views, or financial status. Always bearing in mind the patient's welfare and showing them due respect, not to betray their confidence and keep private all knowledge concerning the patients, even after their death. To protect the dignity of the medical profession, not to dishonor it. To treat my colleagues with due kindness, without questioning patients' confidence towards them, yet at the same time acting impartially and having in mind the welfare of the patients under my care. To widen my professional knowledge and to share with the medical world all that I shall be able to discover, invent, and improve. I do solemnly swear.
Congratulations on this wonderful accomplishment. You all look fabulous in those white coats.
Yes, congratulations. Remember this feeling, okay? Finally, please join us in welcoming Director Professor Grzegorz Ośkinis to close the ceremony.
Okay, thank you very much for joining our white coat ceremony. The ceremony is closed. Thank you for joining us. Thank you.